Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I have Dr. Azizi, a fan favorite, back on the show. Thank you for coming, Dr. Azizi.
Mavi, thanks a bunch. It's always a pleasure to be on and chat away about all these topics.
I'm super excited. Okay, so I brought Dr. Azizi on today to talk about BBLs. Well, I feel like we always talk about BBLs, but there's just so many things to talk about BBLs, right? It's a never ending subject. And of course, I had to bring the BBL king over here on. Let's talk about it.
Awesome. Yeah, there's a ton of stuff. I mean, we've talked a lot. We've had two episodes about this kind of stuff, but there's always gray area stuff. There's always topics of like deeper discussion. I mean, recently, and we're going to be talking about it today, but we just started talking a little bit about recovery, specifically just BBL recovery, and like what is the first month like afterwards, or 2 months, or kind of what are like the stuff beyond compression garments that you have to think about. So, and then we thought about doing this episode.
Yeah, this is really exciting. So we were actually just chatting, Dr. Azizi and I, before. I was like, you know what, we have to pause and I have to start recording because this is just great information. And I'm sure our listeners want to know. So my question to him was, why do your tummy tucks look different than other guys' tummy tucks? And where did you learn some of those techniques that make them look like that?
Yeah. So, I mean, for my background, and we'll talk a little bit about like, what are the different ways to kind of get trained up to do this kind of stuff. So I'm a plastic surgeon. I'm board certified. I'm actually board certified in general surgery and plastic surgery. So it means I did like 4 years med school, 5 years general surgery residency, 3 years plastic surgery fellowship. And then I left and started my own practice and kept working since then. I'm about 5-6 years out for that. So the traditional way to get into plastic surgery was doing general surgery first and then doing plastic surgery residency or fellowship afterwards. Since then, these days, there are what's called integrated plastic surgery residencies, where right after 4 years of med school, you can go straight into plastic surgery and you do like 6 or 7 years there, and you can still do like more training afterwards. So that's what a lot of people are doing these days to be a plastic surgeon. Now, a plastic surgeon is different than a cosmetic surgeon. I know, Mavi, you talk about this all the time, so we can get into that too. But basically, a plastic surgeon is trained in like changing the body and problem solving, really is what it is, right? And so we're very widely trained. Not only do we have like general surgery training, so we're used to like, all kind of like the crazy stuff with like, like cancer and gunshots and stabbings and trauma, like all sorts of like stuff like that. And wounds, exactly. So then we get into plastic surgery where we're trained with like breast cancer reconstruction and like microvascular stuff and cosmetic surgery and like skin grafts and wounds, basically, right? And how to like heal people, how to problem solve, how to get people through issues. And then a subset of that is what's called aesthetic or cosmetic surgery, right? So that just obviously applies to stuff that makes people look better, right? And then kind of improves confidence and the majority of what we talk about online. Now, the difference between plastic surgeons and a cosmetic surgeon, briefly, is that anyone can call themselves a cosmetic surgeon. You can be an ER doctor, take a weekend course, call yourself a cosmetic surgeon. You could be an OB-GYN and not take any courses, call yourself a cosmetic gynecologist or cosmetic whatever surgeon, right? The American Board of Plastic Surgery, when they certify someone for plastic surgery, you have to be super rigorous. You basically collect cases for like a year. It's like one of the highest levels of training, the longest training, the hardest kind of like boards and all this kind of stuff to get certified. So when you get a board certified plastic surgeon, we're all super proud of that. We always talk about it all the time because it's super hard to get to that point. And that shows kind of like our level of dedication and all that. Now, someone who only did a little general surgery or OB-GYN or like ER, and they took a weekend course in like lipo or somewhere like that, they don't have like all those skills to be able to do a breadth of cosmetic surgery. And perhaps they don't have the advanced skills because they only did a weekend course or like 1 year in it or something. And if things go wrong, they don't always know how to fix those things too, So as plastic surgeons, we're always trained to have like plan A, B, and C. And, we did like, all this like super advanced training. So we're always like having ideas, like if this doesn't work or this doesn't work, that kind of thing. And then also some of us go get advanced training. So I did my general surgery in Chicago for 5 years. Then I went to New York for 3 years. I did my plastic surgery fellowship at a program called Long Island Plastic Surgical Group. It's the biggest group of private plastic surgeons in the nation. So it was all private plastic surgery. We did a lot of like cosmetic surgery. And I knew I wanted to do private practice in cosmetics. So I come out, I started doing my work. And to be honest with you, that's when like the real work starts. Like you get your good foundation. I'm telling you, then it's like, it all starts from ground zero again. You got to like refine, right? So like, you come out of art school, you're not going to be the best artist ever. You're then going to work your whole lifetime to become the best artist ever, right? So I think it's important. I mean, we certainly all see surgeons who are 20, 30 years into their career and they're still doing the same old stuff that they were doing 15, 20 years ago. And we can tell that their results are not as good. So someone like me, a lot of us younger guys, we're always trying to get better. We're looking at social media, also seeing what other guys are doing. What are these advanced, super cool tricks and kind of what are people looking like? Also, what's BS out there, and try to get advanced training. So I came out, I did my own practice. I started to do just a lot of like cosmetic stuff and BBLs and lipo and tummy tucks and all this kind of stuff. And I continuously refined over hundreds of cases after I did thousands of cases for my training, and just kept refining and refining. And then, I got into more of the advanced liposuction stuff, which is called high definition, which was popularized and kind of invented by a surgeon named Alfredo Hoyos, who's in Colombia, the country Colombia. And he's been doing it for probably like 20, 25 years now or so. And a year ago now, I went to his training course in Colombia, and I did 3 days of like surgery and immersion and education to basically learn how to do those advanced techniques. Like I was doing a lot of that stuff, and I had seen his videos and books and all this stuff and read all that, but I needed to go and get hands-on to do that and then come back and continue to refine. So that's kind of what my thing has been like. And I guess that's why I have a look to my patients and a certain aesthetic that I think looks nice, and I try to match it to people's bodies so it looks natural but augmented also. And I use that whole long breadth of training and like all that stuff to kind of bring it together. So that's why I guess my stuff looks different, hopefully, than other people's stuff does.
It does. And my question is also, so when you went to Colombia and you saw how different post-op care over there is, were you shocked? Were you like, whoa, they don't teach us any of this stuff. They don't tell us to do this. Why?
Yeah. Kind of, yeah. So like, in the US in the last 5 years or last 3 to 5 years, lymphatic massage has been kind of the thing that like, 5 years ago, perhaps not everyone was doing it or very few people. And now we're like, okay, we're in agreement in general that lymphatic massage is beneficial for lipo and tummy tucks, depending on when you're doing it, right? Post-operatively. Mm-hmm. And everyone's a little bit different about their protocol. But yeah, I went down there and like, forget about massage. They've been doing massage forever. I mean, they would do like 10 days of like massages afterwards, which would be like, you would start with like ultrasound cavitation massage, for example. They would do like certain like little boosty kind of things that'll kind of squeeze things out. They would do hyperbarics, which not a lot of people are very like, almost no one does in the US. So you'd sit in the hyperbaric chamber, which is a chamber that pumps oxygen at a very high pressure. So you get a super level of oxygen into your bloodstream, which oxygen is king when it comes to wound healing and, kind of avoiding infections. And like, if you have a lipo burn, reversing that kind of stuff, right? So they would do basically a 2-hour protocol, like every day for 10 days after surgery. Like it's a lot of stuff that they're very advanced on, a lot of nuances. So it's always good to go outside the box so that you're not like just getting very pigeonholed and kind of seeing things, just from our view, Yeah.
So tell us about, before we go into what we were going to talk about, but this is just so amazing to me, your facility and how you built it out.
Yeah. So, as a surgeon, you come out and you get usually privileges at like a surgery center or a hospital. And that's why you'll see a lot of surgeons either at surgery centers or hospitals, because like, it's funny, you'd come out of plastic surgery and you're training and you're like under all this debt and everyone's like, okay, so you're just going to like build your OR and stuff. I'm like, oh, honey, an OR is like $1 million, $2 million, you can't just come out and like, it's like, you don't get your driver's license and then they issue you a Ferrari right afterwards. That's how, the plastic surgery thing works. So a lot of us will get privileges at either surgery centers that are outpatient or at hospitals or both and do our surgeries there. After time, if you have a good amount of volume and you have like, you want to go through the trouble of building your own place because there's a lot of benefits of that, a lot of us go do that, right? So like for me, I want my patients to be treated as good as possible. So like, no matter how much I would micromanage things at a surgery center or a hospital, and I had privileges at like some really good places in Chicago, where celebrities even would go to and stuff. And it wasn't at the level of I wanted for my patients, and like ultimately, in order to have that, you have to build your own place, have your own staff so that everyone cares about your patients as much as you do. And, you're hired well and everyone cares. So yeah, I got a building. Over the last year and a half, we built out a center in Chicago, which we have our own operating room now. So I can operate all my patients the way that I want to with my protocol. We have our own staff, so everyone's nice and everyone cares about plastic surgery patients. The plan is to have in-house massage soon, potentially that hyperbaric chamber. We have a recovery house upstairs as well. So it's kind of like a very unique spot in the Midwest, and not a lot of places are like this, that in one place we have a one-stop shop for like breast and body contouring. The people can, from out of town, they come in, they get their surgeries, the consults, they go upstairs to recover, come downstairs for post-op. So it's like this big old thing. And it's a lot of work and effort, but I'm super happy with it because I'm finally able to give the entire patient experience
exactly
the way that
how
I
you want it.
Exactly. It's so important,
I'm so excited for you. You have to let me come up and see.
Yeah, you got to come see it. I don't mind. Come through, man. Yeah, I've definitely got more gray hairs now, though. But that's fine.
I've had a few of my Chicago girls tell me to come do a meetup in Chicago.
Oh, that'd be awesome.
We'll do it at your place.
I'm down.
Okay, so then now let's talk about this protocol. Okay, the protocol. So you went to Colombia, you learned, what they're doing over there. You combine it with what you've been doing here and the different protocols. So tell us about sitting and the science behind not sitting, how long to not sit. Why do some doctors say 3 weeks? Other doctors say 6 weeks. Other doctors say 12 weeks. And and it's even varies so much as you can only sit to use the toilet or you can sit for up to 15 minutes. It's just such a wide range. So I'm super excited to hear what you have to tell us.
So sitting is still controversial, believe it or not. And by controversial, I mean that everyone's got their own ideas of it. Every surgeon's got their own ideas. And they usually base this on their experience and what works good for their patients. So to summarize, essentially, surgeons will tell you a few different categories. Like you said, some will say, go ahead and sit right away. No science, no articles show that it makes a difference when it comes to fat grafting. Go ahead and sit right away. There's a lot of people that say 6 weeks. They don't want you sitting on the butt or the hips for 6 weeks. I'm personally at 3 weeks, so I kind of split the difference there based on certain science. So when you do grafting, and we know this from like skin grafts. So skin grafts, we can study really closely and see at what level, what is happening in it. It's harder to know it with kind of fat grafts. So we take our skin graft knowledge and we move over to the fat grafts because fat grafts are a little bit more newer in the way that we're doing high volume fat grafts for the butt. So when you do a skin graft, the first few days afterwards, the way that a skin graft works and kind of lives, if you take this piece of skin, you put it down, is through, it's called imbibition or osmosis or diffusion. Basically, the cells sitting next to each other, they just kind of sweat out a little bit of oxygen from one to the other and nutrients, and they start to take that way. After about a week, new blood vessels grow in there. That's super important because each little skin or fat cell has new blood vessels, all right? So once you get to about 3 weeks out, I have found that, we've had a couple of weeks of new blood vessel growth. And if I allow my patients to sit at 3 weeks and beyond, I have not found big differences with their look, meaning that like when I see patients at 1 month and I see them at 3 months, if they've been sitting, they still look the same. Like we do not have like more fat loss and stuff. Now, that's my thing, 3 weeks, because every one of those little fat cells does have a blood supply to it. There's no fat cell hanging around after 3 weeks. I feel that does not have a blood cell that's kind of still hanging on for dear life. It's just not going to happen at that point. They'll have either reabsorbed or dissolved or died by that point, right?
So now, 3 weeks? 3 weeks?
Yeah. 3 weeks is what I say. And that's one of the few things that a lot of things I've changed a lot, continuously refining it over 5-6 years. One of the very few things I have not changed is saying 3 weeks for patients. Now, I'm okay if they want to do more, right? And timing comes into it too. 5 minutes, 10 minutes, we'll talk about that too. So a lot of surgeons will say 6 weeks, right? Now, you got to remember that like if you tell someone not to sit for 6 weeks, that's extremely difficult. It's already hard enough for 3 weeks. People are not able to take 6 weeks off of work. They're not able to like not sit for 6 weeks. It's really hard practically. So you're trying to like fit this post-op protocol into people's lives practically. I mean, it's already hard to tell people 3 weeks, let alone 6 weeks, right? I'm okay with some people. I find that half my patients after 3 weeks, they start sitting right away. Awesome. Half of them are more conservative and they'll stretch it out to 6 weeks. All right. So some people out there, some of my really good plastic surgery friends with great results will say 6 weeks. And I think it's a little bit more on the conservative side, but I'm okay with my patients not sitting for 6 weeks, and that's fine. I think that after 6 weeks, you run into issues of kind of the butt becoming deconditioned. So patients that I have had that take 2 or 3 months to not sit, they don't get any benefit. I'm not seeing that booty being any better. Even from 3 to 6 weeks, I'm not seeing that big of a difference at all. But people who are not sitting for like 2 months or 3 months, that booty becomes deconditioned, the muscle becomes deconditioned, and they start to have like just more soreness when they're sitting. And it's just like they're just not used to it. It's just too much time off of the butt. And it's kind of, I always tell patients, I'm like, look, it's going to feel weird when you start sitting on it again, even after 3 weeks, because we did surgery on it. And even if I didn't do any surgery and I told you don't sit on it for 3 weeks, it's going to feel weird when you sit on it. If you don't use your arm for 3 weeks, it's going to feel weird. Your arm's going to be weak after 3 weeks without doing any surgery, right? So it's going to feel weird after 3 weeks. or 6 weeks, I usually say you can start doing 20 minutes on, 20 minutes off, 30 minutes on, 30 minutes off to see kind of what that feels like. So that's 3 weeks, 6 weeks, 2 months, 3 months, what my thoughts are on that. You want to get into like 0 weeks and that kind of stuff too, and like how long to sit on the butt?
Yeah, for sure.
Okay. So here's the other thing that comes into it. The amount of time and blood flow and that kind of stuff. So what we know is that when people get like ulcers from laying in the bed for too long, that happens because you sit on an area like the heels or the butt and you don't move. And after 30 minutes or 60 minutes, you can get a little bit of breakdown of the skin or a little tenderness of the skin. After 2 hours, you get breakdown of the skin. So the timing of it is significant too. So it's not just like the amount of weight. And how much weight? Okay, so, our compression garments may be like 15 pounds of compression, 5, 10 pounds of compression. They're not a lot of compression on the butt. It's just kind of like a gentle hand kind of pushing on it. So not a lot of compression. But if you're sitting on the butt, obviously that's like 50 pounds or 100 pounds. So the timing is key, meaning that like the longer you sit on it, the more you're clamping off that blood supply for a longer period of time. So 5 minutes, 10 minutes probably won't make a difference. So like for sure you can go to the bathroom. In fact, even when you wake up from surgery, you wake up on your back, you're like, we have to wake you up on your back. You're waking up on your back 10 minutes, 15 minutes until you perk up. We turn you over. It doesn't change the results, So 5 minutes, 10 minutes, go to the bathroom. That is fine. What I don't want people doing is more than that, because if you tell people, oh, you can do 15 minutes,
they'll push it to 30.
Yeah. Or they're sitting in traffic, right? So like they'll do it. Drive is 15 minutes. Oh, sorry, doc, it was 20 minutes, 30 minutes of traffic. Yeah. So people will push it. 15 minutes becomes 20 and 30. And that's where we don't know what that time is that the pressure starts to kill. But we know that at least with like pressure and pressure ulcers and skin. And remember, skin's got a better blood flow to it than the new fat I put in there. That new fat does not have any blood vessels to it. Your skin does. And if your skin's going to break down in 30, 60 minutes, if it's going to get injured from 30, 60 minutes of sitting on it, your fat probably will much sooner. So I think 5 minutes, 10 minutes is fine. I think 15, 20, 30 is where it's going to get compromised.
Okay, I like it. So would you say that if a patient is looking at her booty and she's wanting to know like, okay, is it going to shrink any more than this? Or is it going to keep getting smaller? Or is it going to keep getting bigger? What would you say at 3 weeks? Like, okay, whatever size it is at 3 weeks, it probably won't get much smaller, or whatever size it is at 6 weeks. What is it?
I'll tell you, at 6 weeks for sure, it's not going to get any smaller. And I find for my patients, at least 3-4 weeks, I tell them, look, at 3-4 weeks, that booty is stable. The size is not going to get smaller, and you're not going to lose any more fat, because like every fat cell's got a blood vessel to it, and you're not going to lose any more. And I don't find that when I see patients at 1 month and I see them at 3 months, they have not lost fat. The butt has not gotten smaller. But we have like fluffing that happens, right? So there's other things besides just volume. There's also like shape and what the skin is going to be like, right? So fluffing, which comes up all the time. So just to kind of define it, if there even is a definition.
The fluff fairy.
Yeah. So the fluff fairy. So what fluffing is that around what I find from around like 1 month to 3 months after surgery, the skin starts to stretch and it starts to kind of release and soften. And sometimes people start to eat again and get put on a little bit of weight. And so that butt starts to round out. It rounds out because that skin stretches. It also rounds out because around 1 month, everything kind of contracts in the body really tightly. And then it releases in the next month or two. And so that's why when you get to 1 month, you may feel little marbles or balls under the skin or like fibrosis, and it's natural. And 100% of people go through it. So do not freak out about like that firmness and when things look funny around 1 month. But that same firmness and fibrosis is happening in the butt because we've worked on it. Things contract. And then when they start to release in that month 2, month 3, that's what we call fluffing. And it's probably the skin stretching a little bit. It's probably just the new fat getting a little bit kind of like bigger because you're putting on a little bit of weight potentially. And it's like that natural fibrosis of the soft tissues releasing and softening. And so that's what happens. Now, I've seen people fluff from month 3 to month 6 as well, but I think this is more kind of like they're putting on a little bit of weight or something, which brings up like, what about your weight after surgery, right?
Yeah.
Yeah. So people are always like, you got to feed the fat. You got to pound all this stuff like right after surgery to feed it. But remember we said like the fat is not living in those first few weeks because of like the nutrients you're putting in your belly and that's going there. It's living because you got one fat cell next door to another fat cell. And one of those fat cells that has blood supply is kind of like sweating off into the other one and it's getting the nutrients. Like if you eat like a bunch of tacos or whatever, or pizza, you're not going to get that pizza molecule down to that new fat cell. So the only thing that's going to happen by you pounding a lot of food and, badly feeding the fat in the first few weeks is you're going to get a lot of salt in there. You can get a lot of swelling. It's not going to help your fat. Now, eating protein, good for healing. Eating avocados, olive oil, chicken, fish. We know we got to do this stuff. Yes, it's good to eat protein. Yes, it's good to have like vitamins. I do not think you need to start dieting until at least a month after surgery. You don't want to calorie restrict yourself.
Mm-hmm.
But remember, but low salt diet is going to help you a lot too. So don't pound tacos and pizza, but have clean food, have your protein, have your vitamins, and that'll get you to that first month, right? But the weight, I'm sorry. Look, Molly, I'm talking too much.
It's okay. I like it.
All right. So weight-wise, what do I find and what do I tell patients? All right. So your body after surgery, after a BBL, for example, you have new proportions. And this is specifically after a BBL because we've augmented the butt's bigger, and we've reduced the waist. The waist and the tummy are smaller, right? So after surgery, you have these new proportions. And this is like a new body. And your new body has a new happy weight. Remember how like before surgery, you had a weight that you were happy with, right? Or hopefully we all, we haven't seen it since high school and college, but yeah, there was a weight that we know we're happy with, right? So after surgery, I tell patients that you're going to have to find a new weight within 5 to 10 pounds, up or down, that you're going to be happy with. Basically, you put on 5 to 10 pounds, your butt and your hips are going to get bigger. You're going to like that. But your waist and tummy is going to get a little bit bigger. You may not like that. If you lose 5, 10 pounds, your waist and tummy is going to get smaller and more snatched, but your butt and hips are going to get smaller too. Not a big deal because we've already augmented. So you got this great shape, but like your tummy's smaller. Now, if you are on the smaller BMI, if you're like BMI 21, 22, 23, you're smaller, you're one of those girls that's going to probably want to put on a little bit of weight, perhaps, for the booty and the hips to get bigger. If you're at 28, 29, 30 BMI, you're looking at your tummy wanting it to be smaller generally. You know what I mean? So where you're at on that scale, you're probably going to have to find that after surgery, either up or down. What is more important to you, your tummy or your absolute booty or hip size? And that's kind of like a new body you're going to have to figure out.
For me personally, I did have to find a new weight that I was happy at. And I've kind of ranged in there, but it's been so interesting to watch my butt.
Yeah.
It's been like, I watched it. I gained probably about 15 pounds after surgery. And my butt, all the fat cells in my booty expanded. They were big. And as I was losing, they were getting smaller until maybe like a month ago, I was like, hey, maybe I went too far the other way.
Yeah. Well, you probably passed that point at which because you want to have a shapely booty and hips. That's like why you got the surgery, right? So like you probably just barely passed that point where you're like happy with it, but you're not trying to get a smaller tummy. When did you notice the differences? Like in the first couple months, after 6 months, when did you stop noticing differences in the butt?
Okay, so I would say probably initially I thought, oh my God, it's too big. I went too big. Oh my God, I'm freaking out. Like I'm looking in the mirror right after surgery. And it's so funny because I've seen it 1,000 times, but it's different when it's you.
Yeah. You think you're going to be the one person in history who keeps 100% of the butt, right?
Yeah.
The one.
Yeah, exactly. Or like I hadn't told, hundreds or thousands of women before, don't worry, it's going to go down. Like, but I'm looking at myself in the mirror saying, oh my God, it's huge. And sure enough, it went down probably by 3-4 weeks. I would say probably by 4 weeks. I had seen a significant reduction and it was, but not in a bad way. Like it was okay. This is how I like it. This is it. This is the weight I like it. This is how I like it. And then I started eating and it got bigger. And I think it wasn't until it got too big that I was like, oh, okay. It is growing. Cause I was like, no, it's not going to grow. Not, but I started to see in my own body and other places that I hadn't gained weight before. For example, my wrists. Like, I'm like, hey, this wasn't here. I think I need to.
Yeah. And there's some areas you can't lipo, right? So some girls, like some areas are tough to lipo. That's why it's so important to get to your goal weight before you get surgery. Like get your goal weight, let's augment this body and have a stable weight. Because like you need to be able to control your weight, whether you get surgery or not. And if you get surgery, you're just kind of throwing away a lot of those results. Or say we augment the butt and then you get a huge butt because you put on so much weight and like that's a problem too. And then you've seen certainly girls who maybe a little bit thicker and they, like they go and they get their lipo and the belly's smaller and this is smaller, but the shoulders are bigger, the arms are bigger, so it's like, it doesn't match. And it's hard. Some of those areas, like, yes, we can lipo arms, but it's really hard to like lipo the entire arm down, lipo the whole shoulder down, lipo, what about like that area from your neck down to your shoulder? Like it's really hard to lipo these things. So it's so important to get that weight in check, whether you get surgery or not. because you need to just be able to control your weight.
I agree 100%. I remember right before I had my surgery, I had this conversation with myself like, okay, do you want to get down to the weight you were before you had kids? And I was like, okay, well, that was before I had kids. I've had 2 kids since then. Like my body is not the same. It's completely different. So I had to accept that I was going to be at a different weight already, period. I'm not going to try to get back down to 118 pounds because why?
Yeah, right.
Why? I don't need to. So I made that decision and I said, okay, I'm going to do it now. And in my mind, I thought, if anything, if I lose weight, it's going to look better. It's not going to, I'm going to be compressing and it's going to look better. And it definitely did. Since I've lost a lot of the weight that I put on plus some and went back below where I was when I had surgery, the results have come through. Like I can see more of the ab etching. I can see more of my abs come through. And I'm like, oh, okay.
Yeah. It's true. Well, we'll do some of that stuff and I'll do it, like ab etching is probably, doable on 25 BMI or less, for example. But, I'll have patients that are 25 to 30 BMI and I'll do some of those techniques. And like, you almost like, I leave it in there so that if they do get their weight down, it starts to like reveal itself, so it's underneath there. And like, look, you get surgery, you're not able to hit the gym, you're kind of just trying to recover and you put on some weight, 10, 15 pounds, it happens, right? But all those results are there. So you lose that weight, those results are going to come right back, So
that's why on the show, I preach, get down to your goal weight. But also I do preach, accept that you're going to be at a different weight. Like you don't have to get back down to what you were when you were 18 or 20. If you're 45 and you've had 3 kids, it's okay for you to be at a higher weight. Your body's different.
The body is different. The fat deposits, I find that even if the skin is good quality, say you've had 2, 3 kids, even if the skin is good quality, I think what happens is like hormones change, you go through pregnancy, fat deposits in certain areas, and it just kind of doesn't go away sometimes, so you're kind of stacking. You have 2 kids, you have 3 kids. You could come in and have like beautiful quality skin, you don't need a tummy tuck, but that fat has kind of stacked in different ways, So yeah, your body's just going to be different, but like you always try to get your body to the best that you can. You know what I mean? And it doesn't mean like starving yourself necessarily and being unhealthy about it. And it's true. Some people are healthy or they like themselves a little bigger and thicker, for example.
I have come to enjoy myself a lot more bigger and thicker.
Yeah. No, I totally get it. Yeah.
Okay. Answer this question for us. How long do they have to be in their faja? How long do you recommend for foam and ab boards?
Yeah. So remember, just to review, I tell patients that it takes about 6 months for you to get your final results when it comes to swelling. And you'll get results after that, but the majority of the swelling is gone in 6 months. So the first few months is where we got to support the body. And it's kind of like, I find that like if you do a little bit of lipo, you go to a surgeon who doesn't do a lot of lipo, then your post-op protocol is not as fancy and it's not as like big because you don't have to support all this work you've done. But if you're doing like ab etching and like, high definition with tummy tuck and like all these kind of super advanced techniques, you have to have more support to that body, which means that like we have specifically picked a very specific garment that we know is like not too tight, not too loose. The stretchiness is good that we have noticed that has not hurt patients. We do foam or boards depending on what our experience is, right? So number one, you got to trust your surgeon. If you like your surgeon and they're delivering these results, what works for them, just listen to what they say. And you're not trying to like pick and choose protocols from different surgeons because everyone's going to have a little different technique. And if you start mixing protocols, it's like when you were a kid and you did a suicide with like the Coke machine, right? Remember you'd like go like Coke and 7-Up and Sprite and orange, whatever. You're like, yeah, each one of these is good. But if you start mixing them, it's all one big, nasty, jumbled mess that doesn't taste good, right? Doesn't work. So for me, I tell patients, I put a big piece of foam on the belly and I also put them in a stage 1 garment. These days I use merino garments because I think the merino's got good stretchiness. It's not too harsh on the skin. It's a nice quality fabric. And I like that for first stage, for the first month. I want them to wear the garment and the foam all the time, day and night for the first month. They can take it off the shower and wash it, no problem. I think a couple hours is not going to make a difference, but most patients that first month, they crave that support. The body craves the support. You do not feel comfortable without it. And then month 2, month 3, I recommend at least 12 hours out of the day with the garment. Now, this is when they switch to a stage 2 garment. So usually a stage 2 garment has a tighter fabric on it. It's like almost impossible to get yourself in it when you first start. And usually you're switching into that around 1 month. And why 1 month? Because the first few weeks, the first month, your skin is really sensitive. It's actually pretty numb. So you can't really feel it if that garment is digging into you. So you just need snug compression and good support, but you don't want something that's going to you're not going to squeeze all that fluid out and look snatched at 2-3 weeks. It's not going to happen ever, but what you will do is you're going to create creases that aren't going to go away. You're going to create burns on the side that aren't going to go away if you go too tight too soon, right? So I do recommend 12 hours out of the day with a stage 2 garment, month 2 and month 3 at minimum. But I tell people that the more that you wear it, the quicker you're going to see those 6-month results because you're just squeezing more fluid out, for example.
I agree. Okay, answer this question for me. If a patient wants a natural look, what is the average amount of fat grafting that you would? Because this actually, I have an episode coming out soon with Dr. Andre Marshall, and we were talking about this.
By the way, Andre and me are friends. Do you know that?
Oh, really? No, I didn't know.
So me and Andre and another surgeon, Brian Wang, who you may know from LA, I met them all around the way and stuff. So we actually have a group chat, specifically it's called BBL lovers, like BB lovers. And we basically started it because we would just talk about BBL all the time. So we basically, me and Andre and Brian Wang, just talk surgery and butts and the pros and cons. And we talk smack and we talk smack on other surgeons and we rant about patients and but we also share skills and what we found to work. And so it's almost like you're crowdsourcing it.
I love
or
that.
Having a little knowledge network. So how you guys, as patients have forums and stuff that you'll talk about, us as surgeons, we want to kind of share knowledge and stuff too. Right. So those guys are good friends of mine and
I love that.
Things all have very similar. Yeah.
I love that. So we were talking about this, what does a natural BBL, or a big BBL? And what he said was, natural is different to every surgeon, which yes, absolutely it is. So we understand that natural looks different to every surgeon.
And patient.
And patient. Absolutely. Yep. And patient. So when a patient is asking for a natural, of course, it depends on their body frame, a natural BBL, what amount of cc's is average?
Okay, so this is going to be different for every surgeon because it's different for every technique. Because here's why. If you use a certain gravity decanting method of processing your fat where you put a lot of water in there, you're going to have a lot of water in that fat when you put it in. It's going to be really watery. A lot of that water reabsorbs. So you need to put more in order to have actual fat in there. Some people put less in. Some people are used to tighter butts and less tighter. Here's the other thing. I never talk about how much I put in that butt. You will not find that in my post unless people ask. I'm not lying. I won't lie and I won't hide it, but I do not put it in there because it's just like breast implants. Remember, it doesn't, everyone's different. A 600 on you is going to look different than a 400 on someone else, or a 600, height, weight, shape, all the stuff, right? Okay. So then there are numbers that I feel more comfortable with. I think the natural thing comes more to the shape that you're creating rather than the amount that you're putting in. The amount is more the difference, right? If you put in 200-300 cc's, and I tell patients about 50% of that's going to reabsorb. You put in 300 cc's, 150 is going to stick around. That's almost nothing. You won't notice any difference. If you put in 2,000 cc's in each side, 1,000 sticks around, you notice a big difference. However, 2,000 cc's is a half a gallon, and you cannot get 2,000 cc's on each butt in the majority of people. It's if you told me, Dr. Azizi, can you put a basketball in my butt? It's not going to stretch that much. You can't do it, right? So there's a sweet spot that works and how much people's butts can stretch. I break that down into 3 areas, which is basically the butt itself, the round part, the hip on the side, and then the transition area down to the thigh. These are the 3 areas. And I analyze these 3 areas on each person and see how much do they need, how much do they want, right? So you find that a lot of people have tight hips, so you have to usually max out the hip. You find that a lot of people want a big difference in one round, so you got to max out the butt. And you find that if you max out the hip, you max out the butt, and they got a smaller thigh, then you got to graft a little bit into that transition area to get that. All right. So numbers wise, there are numbers where I feel more comfortable. Listen, I like to do at least 1,000 cc's on each side at least. If I'm coming away from that table with less than 1,000 on each side, I'm disappointed. My average is probably 1,200 to 1,600 or so per side. I have gone up to 2,000 in patients. I've gone recently, I did 1,800, 1,700 on each side. These are patients that have either a bigger butt to start with, so it'll take more. Perhaps they had a little bit of weight loss, so the skin's a little bit more stretchy. Now, remember, the stretchy skin is not helping us in the belly and the flanks with lipo, because if you have stretchy skin because you've had kids, then we probably need to do a tummy tuck or a mini tummy tuck. But if you got stretchy skin in the butt, that's helping us actually, because we can stretch it out more, get a couple hundred more cc's in there. Now, I don't think the volume, whether I do 1,000 on one girl or 1,500 or 16 or 17, or 1800, all these girls, I still find that patients they'll say that they have a natural look, because I think it's very important to go based on the landmarks of the butt and the hips and the thighs. That I think is the most important thing, whether you're doing 100 cc's or 2000 cc's, because you could do low volume and still create a poor shape if you don't do good lipo and you don't do good fat grafting. So what I find in bad results, or why people will often come for revisions, is surgeons who, and remember, these are the surgeons who took a weekend course, or maybe the surgeons who all their assistants are doing all the stuff and they're not doing any of it. A quote unquote cosmetic surgeon that doesn't know what they're doing. Now, when you say that, there are people like Calvin Jung, who I think does incredible, immaculate work. He's kick ass. His work is amazing. I think it's really good stuff. And he's a cosmetic surgeon, but he is few and far between when it comes to that kind of thing. All right. He has refined his technique. He did training with Alfredo Hoyos, who I did in Colombia as well. And he's very selective with patients. And it's a different ballgame, right? Now, from what I find from people who don't know what they're doing or are coming for revisions, they've either injected the butt too tall, meaning that they're trying to get an abnormally big butt, but they don't know, they're being stupid about it. And they're not injecting to the top of the natural butt of that patient. They're actually injecting almost to the lower back. So they get this weird tall butt shape. And when people look at it, they know it looks weird, but they can't say why. It's kind of like if you see a weird face or a weird body or a weird something. Evolutionarily, we have been trained over thousands of years to know what looks weird and out of point, but we don't know why. Here's another thing. Male butts are taller and female butts are shorter. So if you're trying to artificially make that butt bigger and you're just injecting it another 1 inch taller, you are now creating a male butt on a woman, and that is not going to match, and it's not going to look natural no matter how high or how low volume you do. So you got to watch those landmarks. Hips, the same thing. You know
what? You are 100% right. And I have a mental image of an ant.
Yeah.
And why do some booties end up like that? What is it?
Okay. So an ant, the biggest thing with an ant's booty is when the butt itself does not match the thighs. All right. So that's kind of the biggest thing. If you have a narrow, small thigh and you got a really big butt. Now, if you have to point to one thing, that's the big thing. So what I find is that perhaps amateur surgeons or surgeons who are first getting into this, they're only injecting the butt itself. Remember I said there's kind of 3 areas that I inject: the butt, the hip, and the transition area down to the thigh. All right. Now, if a person comes in with a big butt and you just inject that butt and you're not injecting the hip for an hourglass, or you're not injecting to transition it down to the thigh, you're going to create this butt that's extra big. The thigh is not going to catch up. That's going to look weird, right? It may look impressive from one angle, but it's going to look weird from multiple other angles, right? So what the problem is, then these patients who don't like their ant booty will then go to another amateur surgeon, try to fix it. And that person injects the butt again and doesn't inject the thigh to transition it, doesn't inject the hip. The big trouble is now they're way behind the ball. It's really hard to make that body better because you can only inject 100 cc's into the transition area, 150. It does not take that much. So you can't sit around. Yeah, the butt will take a lot. The transition area and the hips do not take a lot. So you have to inject those things on that first stage and analyze them to make sure that everything is matching and everything looks good from multiple angles. Because if you keep injecting that booty and you haven't injected the rest of it, they can come to me and I can't stuff in enough to make it look normal. It's no, we got to start doing a reduction of the butt. That's not hard, but it's hard to make patients happy with the reductions of the butts. So kind of gone 2 steps down the wrong lane and you're trying to back up, U-turn, and then go back down the other way. So the ant booty is when you have a mismatch of a really big butt on a narrow thigh. And it happens from people who get a lot of butt injection, no hip and no thigh injection. And then perhaps they put on weight or they go on to another surgeon, right? So now they put on another 30, 40 pounds and that butt has grown bigger. The thigh has not grown that much bigger. And now we're that shape is getting even more exaggerated. Exactly. That's the ant booty look.
That's the ant booty. And that's why it's so important to do that. Hip. I actually talked about it in my last episode about don't skimp out on doing the hips thinking that you're going to look too wide or too hippie because you're not. You
can only go 1 degree up in surgery, right? So if you come in, so there's 3 types of people that come in with a hip. You either have a hip dip that's tight. So you actually have a hollow. There's people who come in what I call a neutral hip, meaning that it's straight. All right. Just goes straight down, doesn't dip, it doesn't come out. And then you have people who come in with a hip, a little bit of a curve, right? So if you're coming in with a hollow, remember I said you can only get so much into the hip. You're coming in with hip dips and a hollow, you max out that hip, you can get a rounded hourglass, but you're not going to look like a big crazy hip. It's not going to happen in one round. If you come in with a neutral flat hip and you max it out, you'll get some nice rounding and you'll probably look like what most girls want to when it comes to like an hourglass.
Mm-hmm.
Now, here's the other thing. When it comes to patient satisfaction, if you already come in with hips, most women know if they want more hips. If you come in with, here's the thing, if you come in with a butt and hips already, and you're coming in for a BBL, that means your butt and your hips are not enough for you. They may be enough for somebody else, but they're not enough for you. So we should put in a bunch in there and take you to that next level, because whatever that beautiful hip is that you have, you may come to the table with hip, but you want more. It's literally like you find yourself into a plastic surgeon's office, you're asking for more hip, we should augment the hip. But like that first girl who's got the hip dip is afraid of the look from the girl who's had either multiple rounds or already came in with a hip and want only one round. You're not going to go like 3-4, levels up in one round of surgery.
I have a question for you. Is the retention different in the hip than in the butt, than in the transition area?
Probably yes, because the retention has to do with, remember when we're packing those fat cells in there, remember I said like you want a lot of neighbor cells that have a good blood supply to them. So in the area of the hip dip and like the transition area, these are when you're getting to like the thigh muscles and they're kind of a little bit closer. There is not that much fat in that area. So when you're putting in that fat, number one, the skin doesn't stretch as much. That limits you with how much fat you put in. And number two, the retention isn't probably as good because there's not as many neighbor fat cells, because, you got only an inch of fat in there versus your butt, you have like 4 inches of fat in there, let's just say, right? So you're going to have like 3-4 times more fat in your butt. So that's why your butt's going to have like better retention and you can get more in the butt and there's more stretchiness in the butt than there is in the hip. So yes, probably it's two factors. The skin is tight, so you can't get that much in there. And then you also, the retention, maybe in the hip is 50% versus maybe your butt's like 70%. So overall, you're hanging out at like a 60% or something,
But it's still good results.
Yeah,
Still
definitely.
Good.
I mean, like if you're coming in, you can still, but this is what I always say. I'm like, most women that come in, because I follow the landmarks of the body, and I think we can create a nice natural shape because it follows her hip and her transition and her butt, and not too tall, not too wide, whatever. And I usually recommend most of my patients, I will max them out and put in as much as that area will take. And as long as we follow the landmarks of what's the top of that butt, the lower part of the butt, and follow these landmarks, it will look natural and good on that woman's body. And you can't get another patient's look on that girl's body. And that girl's body will never look like another girl, but you're just trying to augment what this girl has, as well as fix some of the hollows and the problems that she has that she's not happy with.
That's okay. This is my last question.
All right.
Before I let you go. Okay. One of my girls submitted this. Why does the fat transfer to breast not stay as much as the BBL?
Very good question. So part of it is we're trying to figure that out. So part of it is we don't super know, right? But we do know that, like it comes down to patient satisfaction. And we find that like it's hard to go up more than 1 cup size when it comes to fat grafting in the breast. And then you have to have kind of like a good breast to do it to. And what's a good breast? So like, remember when we said, like, if your butt is bigger and you have more fat in there, then there's more neighbor cells that can lend some nutrients. So if you have a bigger breast, it's going to be able to take more fat and it's probably going to have more blood flow to it too to help. So if you have like a C cup, D cup breast, that's probably going to be able to take more and you can get perhaps more than a cup size with that. However, people who have C cup, D cup breasts are not usually coming in for fat grafting to the breast. And the problem is that once you start to get into the bigger D double D, there's no one in a D double D really who doesn't have some level of sagging. And if you have sagging, you can't really fat graft that breast. It's just not going to look good. So first of all, you don't want to have sagging in the breast. And so now you're pushing more towards people who are A cup, B cup, C cup. And A cup, B cup, they don't have a lot of that neighbor cell. They don't have a lot of that tissue bed for you to fat graft into. So you're going to be able to get less into an A cup or less into a B cup. So who wears the sweet spot? Well, it's like, maybe big B, solid C, or a small D that doesn't have sagging. That's the sweet spot. And you can get those people a little bit bigger. So but the woman who comes in with a small D and we do fat grafting to her breast, she's probably going to have a bigger noticeable difference than the girl who is a B cup. And why is that different than the butt? Probably has to do with a little bit of like the blood flow, like blood flow kind of comes from the muscles underneath it. So the butt has like all these muscles underneath it, and they're probably popping up a lot of blood vessels up into that butt fat. The butt is stretchier. There's more volume there. There's like more tissue and stuff. So you can get more in there and it'll stretch out a little bit more than the breast will. There's some odd things with the breast sometimes where like the top hollow area of the breast where everybody wants to fill out because that's where it's perky. You'll stuff a ton of fat in there and it still kind of stays hollow or it flattens out, but it doesn't like expand like an implant would expand it.
I think you're the perfect person to ask this question to. So with fat transfer to the breast, okay, we know that fat transfer to the breast is only to augment. only to augment. We're not lifting. So if your nipples are looking at the floor, fat transfer to the breast is not going to be the answer for you.
Yeah. Yeah.
Would you rather put fat in a breast or go with an implant?
Most surgeons, not just me, most surgeons would rather do an implant because an implant is going to help to shape you out more in the way that patients want. So the patients want upper pole fullness. So you have perky at the top, and you want cleavage, right? So no one wants side boob, really. You want a little side boob for sexiness, but no one's coming in asking for like more side boob because it looks fat, right? And then the central breast, yeah, we want it bigger. But the hard areas to fat graft into are the top of the breast. I mean, you'll do it, but like I said, it kind of doesn't pop out as much. The cleavage works pretty good. But why do we like implants? Because implants have more firmness, a little more structure to them, and they can actually push things outward. And we need them to push out the top of the breast, to push out the inner cleavage part of the breast, right? I will do fat grafting along with like a breast lift to kind of give us a little extra cleavage, a little extra up top. But I don't think that it's limited when it comes to that compared to an implant. An implant's always going to push out and make you fuller, better. Now, if we had tons of great results out there with fat grafting the breast, everybody would know about it because everybody would put in their like fat grafting of the breast, results out there, and we'd have all these banging results, and you'd know about it. There's no secret about like all these guys are fat grafting breasts, and there's all these good results, and you just don't know about it. It's like with the butt. The butt, we used to use implants in the butt. Not me, but like before my time, and some people still do. But the implants have more chance of wound healing issues or infections with the butt because it's just a different beast. You're sitting on it. It's like a little dirtier area than the breast. And when fat came around and it like you had all these great results and you could really shape things, like a lot of us moved to just using fat because it's just awesome, right? The breast is kind of like the opposite. Implants still work really good in the breast, and fat doesn't tend to work as good. And we would all love to be, like us BBL surgeons would love to be fat grafting a ton of breast and making it look as good and really lifting it. But the amount of patients who like don't have sagging or have a big enough or not too small breast to be able to fat graft that is narrow. And then also no one comes in really wanting 1 cup size more. That's like a 150, 200 cc implant. No one comes in wanting that. So it's kind of like, and here's the other thing. It takes more time and it costs more. So a breast implant case is going to cost less than fat grafting to the breast. So a lot of people do not want to pay more for less results then.
Because
so all these factors come together.
You're 100% right. So when you're paying for a breast augmentation, you're paying for about 1 hour of operating room, some implants, anesthesia facility for 1 hour. When you're paying for a fat transfer to the breast, you're paying for liposuction to the torso or wherever they're going to be grafting the fat from. You're paying for, it could be 2 to 3 hours of OR?
Yeah. Everyone's different, but you're right. For me, it takes me about an hour in the OR for a breast implant case. And then, to lipo your belly and put it in the breast, maybe it's 2 hours, 2.5, 3 hours. But it's significantly longer. And then it's not like, oh, we'll just take a little bit of fat from the belly and put it up the breast. It's like, no, you still want us to do a good job on your belly. So we actually have to like lipo it like we're really lipoing it, who is it that it's good to put fat in the breast in? It's people who are coming in mostly for like lipo or tummy tucks or BBL. Maybe not BBL because you got to lay on the breast or lay on the butt. But if you're already come in for a lipo procedure and we have this fat and you're like, look, I wouldn't mind a little more in the breast. I'm not really looking for much, but any boost or any little bit of a difference is good. But if you're trying to look for an alternative to breast implants, it's not gonna do it.
It's not gonna do it. And I think fat transfer to the breast has become just everybody's talking about it. It's such a hot topic. My girls are asking me about it, and I'm seeing it more and more online. So I want to talk about it because I know that it has its pros, but it also has its cons. And when a patient is looking for volume, I mean, they really have to weigh out all of it, weigh out all of your options and go with whatever's the best for you.
Yeah. Yeah. Fat is a good adjunct. It's a good supplement, but it's like vitamins. You're not usually just going to live on vitamins. You're going to live on like good natural food. And then it's good to add the vitamins in there. So sometimes we'll do, you can do an implant with a little fat in the cleavage area, maybe, or like you do an implant, maybe you want a little bit more cleavage, but the implant's not going to get any closer to the midline because your muscles are kind of blocking it. Well, for some of these people, fat is perfect. Just a little 75 cc's of fat and then in the cleavage area pops it out. Awesome. Beautiful. But it's a good adjunct. Yeah.
I love it.
There you go.
Okay, Dr. Azizi. Okay, this is my last question.
All right.
What are your predictions on the BBLs? Do you think BBLs are going away?
No, I think BBL is kind of like once the floodgates are open and we know that we like it or it's okay and it's out there and in social media and TV because look, okay, you got like Sir Mix-a-Lot. baby got back in the 90s, right? And that kind of like was the first kind of discussion of butt in the modern era, I guess you could say. And then like you got like J-Lo comes out, people talk more about butt. And then you got like, Nicki Minaj, and like now you got like, like really big butts, right? So you got like Megan Thee Stallion and all these kind of stuff, right? So this is kind of how things have gone, and we know as a society we like more butts, or maybe we always did, but we talk about it and we're okay with it, right? So what's funny is if you go back and watch the Sir Mix-a-Lot video, those butts are way smaller. Those butts that were big then are like nothing. None of my patients would be happy with that butt right now.
Like, I'm going to watch that video. I'm going to watch it.
No, yeah, you'd be surprised how small those butts are right now by what we're used to. So I think it's like tattoos where like, now that if a third of the population has tattoos, well, it used to be just, one tattoo was like rebellious, but then a whole sleeve right now is totally fine. And like, it's like fine kind of across the board, no matter what you are. You could be a super professional, having a bunch of tattoos is fine. Because I think the floodgates are open, more people are okay with it. And there we have it. I think that the pendulum swings back and forth, like how when implants really came in the 90s, we were big with implants, breast implants were really big. And then like, people kind of see bad breast implant results. So now people are afraid of ant booties. So you have people who are afraid of going big. And so the pendulum swings back a little bit more. I've noticed this from like a shelf bubble butt swinging back to like a slope booty, and then kind of swinging back to like, I don't know, more perkiness. So I think that pendulum swings back and forth, but I think society likes big butts and we're okay with them. And there's no stigma about it really, or there's less stigma about it than before. So I think BBL is not going anywhere. And I think I see it as more of an evolution of lipo. So lipo, which has been done for like, let's say since the 80s, we know about lipo being done quite a bit, even though it was done before that. Lipo and breast implants are always like the two highest volume procedures that we do in plastic surgery. Lipo, for like, 20, 30, 40 years, right? The evolution of lipo was just like, oh my God, we have this fat and we can actually shape things with it. And 90% of women want to improve some aspect of their butt and their hips with it. It just became, I think, the evolution of liposuction. So like, I don't think it's going anywhere because it's like liposuction and then some. So I think that's where we're at right now.
I 100% agree. I think you're right. I don't think it's going to go away. I think maybe we won't be going as big. I think the really, really big ones will probably come back down to normal, and they're always going to be around. Some form of it. You guys might think that girl doesn't have a BBL, but she probably does. It's just done very, very well and very discreetly, very natural looking. So I don't think BBLs are going away. I saw an article and it was a question, are BBLs going away? And I'm like, I don't think so.
The only way they're going to go away, listen, what I find from people coming for lipo, 90% of patients have something about their butt and their hips that they want to improve. And if 90% of patients came in and their butt and hips were awesome and they loved them, and they were like totally happy with them, they just wanted lipo, then we would just be doing lipo. If you got something that you want to improve and lipo's not going anywhere because it's America and we're all thicker than we want to be. And even if you're thinner, you want to like, create a much even better shape around your midsection. And no one wants to throw away that fat. It's just kind of like the cherry on the sundae,
Yeah. Thank you so much for coming on the show, Dr. Azizi. I
My
enjoy
pleasure.
having you on every time. I love how giving you are with your information. Like,
Oh, well, I love people listening to me because I can't stop yapping. So as long as people keep listening, I'm happy to talk.
It's a good combination then.
Yeah, pretty much. Yeah, I hope it helps. I hope it's good content. And, these are all, I think, super interesting topics to me and on the surgery front and like things that we see and deal with all the time. So hopefully it helps people on the other end of it,
It will. I know my girls they love you. Every time you come on, they're like, oh my God, Dr. Azizi's back. They love your episodes. Your episodes, along with the Faja Doctor, are some of my most played episodes because
Awesome.
That fat grafting BBL episode went viral in a fat grafting group.
Oh, that's awesome. Oh, I love it. That's awesome.
They got to hear you. They get to know you. They get to learn because they're learning online, but how can you distinguish what's fact and what's fiction, especially when it comes to sitting?
Totally right. And especially if it's a controversial subject that it's not, well elucidated and we don't know what the right or wrong answer is, then where do we all kind of hang on that subject? What's important to know, what not,
Exactly. Yeah. So I'm so thankful that you came on the show with us today, and
my pleasure.
I will have you on again soon. Probably more fat grafting talk.
Okay. Cool with me.
Thanks for coming on the show, Dr. Azizi. I'll see you again soon.
See you.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.